Good morning, everyone, and welcome to another Medical Minute with Colorado Springs Orthopaedic Group. Today we're sitting down with Dr. Jamie Friedman to talk about cartilage restoration. So first, to start off, what is cartilage?
So when we're talking about cartilage restoration, we're really talking about articular cartilage in particular. The purpose of articular cartilage is to do exactly what it sounds like, help the bones articulate or glide smoothly against each other. Articular cartilage also provides shock absorber for the knee joint, especially because it's a weight-bearing joint. Unfortunately, when cartilage is injured, it doesn't actually heal itself because there's no blood supply to it. So that can mean early arthritis.
Okay, so what are some of the symptoms people should look out for when they're thinking of a cartilage injury?
Cartilage injuries can occur with either a traumatic injury or over time with repetitive motions such as just general wear and tear. A patient will typically have increased pain or swelling after a particular activity or at the end of an active day. They may also have mechanical symptoms such as painful clicking or catching when they bend or straighten their knee. In very advanced cartilage loss, a patient may be severely limited by this pain.
Okay, so who's a good candidate then for a cartilage restoration procedure?
That's a good question because it's really about choosing the right patient for this surgery. So the best candidate for a cartilage restoration procedure is typically an active young adult. This is so that we're preventing them from going on to developing early arthritis. These are patients typically too young for a partial or total knee replacement, but they still have severe pain from this cartilage injury.
Okay, and what are the different procedures that can be done?
So there's a wide variety of procedures that we can do for cartilage restoration. Some of the most advanced techniques are still arthroscopic or minimally invasive with a small incision near the joint. When the cartilage itself is the only thing involved, sometimes all we need to do is take cells from the patient or from a donor. We send them to a lab and then we get them back and place them over the cartilage defect, kind of like filling in a pothole in the street. This is called chondrocyte implantation. However, if the bone underneath the cartilage is also affected, then sometimes we'll take a plug from the patient or a donor and put that into the defect, kind of like a peg into a hole. This is called osteochondral autograft or allograft transplantation.
What's the recovery time we're looking at for something like that?
So it really depends on what kind of procedure we do, but in general, a patient will be partial weight bearing for the first 6 to 8 weeks while we allow that cartilage to heal. At about 2 to 3 months, we add in more range of motion, strength, and balancing activities. About 4 to 6 months is how long it takes to get back to their normal activities. Even though this is a longer recovery period than some of the other surgeries that I do, it's definitely beneficial to be able to eliminate the patient's pain and save them from an early knee replacement.
Thank you so much for all of that information today. It's been so helpful.
Thanks for having me.
Of course, and you can find more information about Colorado Springs Orthopaedic Group online at csog.net.
Yes, thank you, Mia. And all that info up on your screen right now. The phone number, plus they've got 2 locations you can go see them at, and of course follow them on social media on their Facebook page. The segment has been sponsored by the Colorado Springs Orthopaedic Group. All right.